You're listening to Seattle Real Estate Podcast.
What's up, everybody? What are we talking about today? The new Wasteland, COVID-19’s Shameful Legacy. That's a great title. We're going to go way outside the box here. Not really, but a little bit. This is from the Association of American Physicians and Surgeons. This is some medical stuff. These are doctors here. I want to read to you an article by Dr. Marilyn M. Singleton. She has an MD and a JD. I don't usually read people's bylines or their bios. Where is that? I lost it on this one. I had it on a different article, but while she was in residency for her anesthesiology program, she just shuffled over to UC Berkeley and earned a law degree, just, in her spare time. So I thought that's a pretty amazing story. Let's check out what she wrote here. And it's a pretty dead-on article from my perspective. I haven't done much in the way of COVID because you and I all kind of know that a lot of that stuff is, it is what it is, and we've experienced what we've experienced, and we've known that the lockdowns, problematic. How's that? Problematic. This is an article that kind of outlines, all right, here's some of the impacts that happened because of the lockdowns that went down. All right, we're going to jump on into that. Before we do, if you're new here, my name is Sean Reynolds. I own a couple of real estate companies, but I read the news that you, as a reasonable person, you want to hear. All right, let's get into it. Discarded surgical masks strewn along the sidewalk aptly represent COVID-19’s lasting legacy. Is that a good legacy? Just a bunch of... Have you guys gone walking and just seen mask after mask? I have. I see them all the time, and it's like, that's not cool. Yeah, somebody else's mask. The federal medical bureaucracy's response to the pandemic has resulted in a wasteland of lost economic and educational opportunities, psychologically damaged children, terminally lonely nursing home residents, and lives lost to suicide, illicit drug overdoses, and missed diagnoses. It's coming from a doctor and a lawyer, right? Thanks to the lockdowns, 140,104 businesses were temporarily closed and 97,966 were permanently closed by September 2020, according to a Yelp survey. Significantly more than half of these were local small businesses, and small businesses employ nearly a half of all American workers. I talk pro-business here a lot, right? And that's one of the reasons I'm reading this article. This is analyzing some of the impacts of when you shut down all this stuff. Here's what happens. Predictably, the workers who were most affected were not the professionals pulling in a paycheck while working from home. They were the working class folks whose jobs the bureaucrats considered non-essential. We picked the winners, and when I say we, I mean roughly governmental entities picked the winners, and you are the losers. We're going to try and throw you some money. It's probably not going to be enough, and you're going to suffer, but this is for the greater good of all mankind. Rightio. The disruption of children's education and socialization will haunt us for years to come in terms of earning potential and mental health. We won't get back this last year. Kids didn't learn stuff. If you're a kid who doesn't sit on the computer well all day long, you're going to have just a difficult time learning, right? And this isn't going to be your thing. You need to be in the classroom or whatever, right? The central planners punished children for months, although the mortality in children from COVID-19 is roughly equivalent to that of influenza year to year. Moreover, CDC data shows that attending school or childcare was not associated with having positive SARS-CoV-2 test results. So why were children barred from attending school? To protect grandma. That's what we were told, right? Even if children were found to be transmitters of disease, they haven't been. A sensible alternative to depriving all students of a proper education and social life would have been to ask children whether elders lived in their homes. Too logical. We can't have that. If so, that group could have been provided with educational accommodations, but the way of bureaucracy is all or none, with no room for individual considerations. Typical of blanket decrees, the most vulnerable fared the worst. 30% of parents from low-income homes reported that their children never logged in to their computer for virtual schooling, and almost half of special needs children received no support. Worse yet, insurance claims for pediatric mental health visits as well as teen overdoses doubled in March and April of 2020 compared to the same period in 2019. Those kids, I mean, they're just, I can't imagine. My kids are older, and I think about parents with kids having to deal with this, and it's ongoing. We've got this debate. Oh, should we go back to school or not? These are crazy times, right? Adults fell prey to the dangers of lockdowns. There was an increase in alcohol sales, use of prescription anti-anxiety medications, and domestic violence. Additionally, the National Highway Traffic Safety Administration reported a 24% increase in traffic deaths in 2020. Almost 2/3 of the seriously or fatally injured tested positive for alcohol, marijuana, or opioids. According to the CDC, the 12-month ending May 2020 had the highest number of U.S. overdose deaths ever recorded in a 12-month period, more than 81,000. This increase was mainly due to illicitly obtained fentanyl. Same stuff George Floyd had in him, right? Yeah, it kills people. People get it and they think they're getting an oxy pill, and actually it's got fentanyl in it because it's way cheaper and it's super strong and it stops their living. They just, boom, done. Anyone who isn't hidden away in an ivory tower could predict that isolated people deprived indefinitely of their livelihoods, recreational outlets, and family relationships would sink into depression. The CDC reported in late June that 40% of U.S. adults surveyed were struggling with mental health or substance abuse, and 11% say they seriously considered suicide. These unintended consequences were foreseeable, yet Americans were subjected to social isolation in the face of no evidence that lockdowns were a useful COVID mitigation strategy. Ironically, according to CDC data, masking, a symbol of our isolation, has made no difference in COVID infections. It's coming from a doctor and a lawyer. Huh. That's interesting, isn't it? I mean, really? And then you always hear all the other arguments and you're like, yeah, but it just doesn't really make sense. I don't know from a medical standpoint. Should we wear the masks? It kind of seems, for those of you listening to me on the podcast and not watching, I'm holding up one of endless blue little surgical masks that I have, because invariably when I want to go somewhere, do you have a mask, Sean? Probably not. I try and keep as many of these around because I still don't have it in my head. I need a mask to go into a store. I need a mask to go into wherever. So I'm forever without these. And I just forget. It's not in my, I don't remember. And so, you got a mask? No, damn it, again. Putting one of these on just doesn't really seem in my mind to really do anything. I mean, it just doesn't. Working out in one of these bad boys is horrific, and I do it 6 days a week. It sucks. But it's what I'm told I got to do to be in my gym. So I do it like a good little boy. But at some point in time, I don't want to wear that mask, and maybe they've just been completely useless against all this. I don't know. But when you've got a doctor saying masks have made no difference in COVID infections, it kind of makes you go, yeah, that's kind of what I think. But it's really interesting to see from a doctor's perspective of what the deal is. With the media's help, the public health gurus waged a campaign of fear to keep us in line while we waited for Dr. Fauci's solutions, vaccines. One of the medical bureaucracy's biggest intentional missteps was the failure to support early treatment of COVID. They told us to stay home until we couldn't breathe. Of course, at that point, the virus had overwhelmed the body. The scientific elite maligned study after study and thousands of clinical successes with early treatment with hydrochloroquine. I can never pronounce that word. Sorry about that. Hydroxychloroquine, I think it is, and ivermectin in favor of unproven high-priced drugs. Despite the CDC and FDA previously acknowledging the 60-year safety record of hydroxychloroquine, butchered it again, it miraculously became harmful in 2020. Just all of a sudden, don't use that. Remember that when Trump suggested it and everybody was like, that's a terrible idea. Awful, horrible. What's he thinking? It is as if the medical bureaucrats are making up the ever-changing rules as they go along. Yeah, I agree. One of the things here in Washington State is we've had a little run. Rona's doing its thing. It's given us a few more cases here in the state of Washington. So we are in phase 3, which basically gives us, as an example, 50% capacity in our gyms and restaurants, things I care about. I don't really go to restaurants that often, but the gym, yeah, you bet. But there really hasn't been that many people at the gym. We're just now starting to get back our numbers. But we are looking at going from phase 3, which is 50%, back to phase 2, which is 25%. I don't think you'll have, much other restrictions, but this is based on these arbitrary numbers. If you exceed this number of coronavirus infections per your state, in state of Washington, we're going to have to go back to phase 2 because this is based on the data or the science. Now, there's zero data or science that correlates. All right, if you have this many cases, this is what gyms have to do. This is what restaurants have to do. There's zero evidence support it. We just think that. We just came up with that. And by we, I mean our governor. They're just throwing stuff out there. It doesn't, there's no cause and effect. It's just, we're doing this willy-nilly because then we're going to feel good about, we're really keeping this thing in check. And there's a whole lot of people who are like, all right, we could have kept this thing in check as best we could, kept the economy open. Let's go. That's my concept. It's not a well-received concept. I think it is behind closed doors because there's so many business owners that are like, yeah, we did all this to save how many lives? Like in the state of Washington, what's the death count now? 5,000? It's somewhere between 5,000 and 6,000. Maybe it's 6,000 now. But look at the impact. I mean, the overall impact to every state that did this. It's horrific, right? So was this worth it? I mean, when in modern days do we do this kind of thing? Never. Just not to this extent. This is crazy. You might say 1918, but yeah, things were a little different then, right? And then people are like, but you got to save grandma. Keep grandma out of the way. Do what you need to there. Let everybody else roll, right? I mean, that was the initial thing, right? It was basically about grandma, the older folks, until we had more exposure to this and we're learning, okay, randomly, a super tiny percentage of people, and everybody's got their story. I was in the gym locker room the other day and I was listening to somebody talk about, I had somebody that I knew. They got the coronavirus and then they died. And then by the end of their story, which, I heard the whole thing while I was getting changed, they're basically like, yeah, but, it really wasn't coronavirus. It was, their poor eating and their bad health. And yeah, they were a little overweight. No, they weren't little. They were obese and, and they were 67. And you hear all this stuff and you're like, okay. So when we know that if you get the coronavirus and if you're healthy, you've probably got, and younger, even, say under 52, that's my age. If you're under that, you've got a 99.9999 what percent of living? Give me those odds every day. You enter into a divorce, into a marriage. What are your odds of that succeeding? Like, maybe 50%, maybe 99.9, my marriage is going to go. I'll take it. You got it. All right, let's go. No, they just freaked us out that, oh my gosh, you've got to do this. Oh, you've got to hunker down. You've got to lock down. It's as if the medical bureaucrats are making up the ever-changing rules as they go along. Yeah. It does seem that, doesn't it? They claim they were following the science. And that's one thing that I have harped on. There is no data. There is no science that correlates these things and like, okay, you get this many cases, you got to do this. No, we're just guessing. We have no idea. We're just making stuff up, right? Why haven't we heard from these politically driven experts as hundreds of illegal immigrants are released into the United States without COVID tests, while U.S. citizens are being fined for not wearing useless masks? That's an interesting question, isn't it? That's a good one. It's a really good one. Hearing more and more stories about people who are needing to fly for business or whatever, needing to have that vaccination done. Yep, that's going to be a thing. And I think I think most countries are going to probably put that into place some way, shape, or form. When, I don't know. And here in Washington, we're going to be able to get our vaccinations, as of, I think, April 16th. So like in a week or so, if you're just dying to get that vaccination. I am not dying to do it. I will do it. I think it's, one more vaccination. But my friend Gavin from Australia, he sent me a text yesterday, I think it was, and 3 or 4 out of 1 million cases of people who are getting vaccinated, or that's the percentages, could develop a blood clot from a certain one of, I think it was Johnson & Johnson from their vaccine. So that has put the vaccination efforts in Australia are just kind of going haywire. It's like, oh no, you get vaccinated, you might have this. It's one of those things, but it's such a tiny, tiny percentage. But all of this stuff is just like, what are we doing? I've had a lot of vaccinations. I've had vaccinations traveling to other countries when I was mountain climbing. You go places and, you need to get vaccinated for this. Okay, that tells me what I'm up against. Interesting. And when you're a kid, who was I talking to? I can't remember. But do you remember booster shots? Are those still a thing? My kids are so old, I should maybe check in on their shots or check in on their girlfriends. Hey, has my son had his booster shots as an adult? I don't really know how that works anymore, but hopefully he's going to the doctor and they're going to the doctors and getting checked out. And yep, they've got all their boosters are up to date. I remember that being a big thing when I was a kid because, man, they use some big needles, right? Some of those shots were like, oh, geez, I can barely raise my arm. Not fun. But yeah, I will probably get vaccinated. Not excited about it, not thrilled about it. But it's one of those things, be a good boy and do what people tell you, right? Because there's a bunch of people in my, circle that are like, oh, geez, if you haven't had the vaccination, you are not serving humanity. Shameless non-clinician bureaucrats have stolen our lives, stolen the smiles from children's faces, and bullied a segment of the population into paralyzing fear. I think that's the best sentence in this post. Paralyzing fear. How many people do you know in your life who are like, oh my gosh, you're not wearing a mask? Oh, good Lord. And if it makes you feel better to wear a mask, then you should do it. But for the rest of us, it's kind of like, yeah. And I am not an anti-masker. I'll do it just to keep you happy if you're really worked up about that. But I kind of don't really have much faith in them. It just seems like a silly thing. Like when I'm in the gym, when I'm on a Stairmaster and I'm going for 45 minutes pretty hard on interval settings, is this mask really going to keep the coronavirus if I've got it? Is it really going to keep it from spreading to other people? I've got questions. I have questions. And I think down the road, you're going to have a bunch of tests come out and a bunch of stuff. Yeah, you didn't really need to wear those masks. Oh, we got that one wrong. It was good that we did it. It's good as a society that we went through this social experiment, but you didn't really. And double masking? Yeah, that was stupid, right? I don't know. We're going to have that kind of thing come back to us? Probably, because we knew all this stuff would happen. You keep people at home. You keep them isolated. Hey, I had a tough time those first, I was going through in my head the other day, Actually, it was this morning. I was watching a Limp Bizkit video that was just so great. I was late for work. I just got chewed out when I got to work by my boss. Oh, no, I don't know, boss. No, I was late because I was watching a Limp Bizkit video, as any mature 52-year-old who owns a couple of businesses does. I mean, that's you guys watch Limp Bizkit, right? Fred Durst, Wes Borland. Amazing. No, I watched a lot of Limp Bizkit and listened to a lot of Limp Bizkit at the beginning of the Rona because I needed something else to kind of keep my mind going. And I got in those mindsets of this sucks, this shutdown, especially for me, because I didn't agree with most of this shutdown at all. Because there was nothing saying this made sense to me. There was nothing. So I kind of did my own thing, figured it out. We worked it out and we operated and, haven't gotten the Rona, yet I've been all over and I've been around a lot of people wearing a mask, of course. But I think so much of this is just hysteria. It is paralyzing fear that is unfounded. But that's just me. And I'm a real estate guy. I don't have any medical background, none. I go to the doctor not very often because I don't need to. And when I do, it's for them just to, hey, you need to come in. We need to make sure you're alive. Yep, you got a pulse. Good to go. Thanks for coming in. So those hiding behind masks, including our precious children, no longer see people as people, but as 170-pound nests of germs and certain death. Isn't that true? Don't we see other people? When you're in the grocery store and do you remember the first few times you went into the grocery store and they had lines on the frickin' floor and which way you had to go? Now, none of us really follow those. We look at those and go, I remember when people used to get upset, but people were really worked up because they saw other human beings, like they would see me as a 215-pound nest of germs and certain death because they had been filled with paralyzing fear. Paralyzing fear. Oh my gosh. Dr. Fauci remains the highest paid federal government employee, and Dr. Birx has moved on to her private air purifier consulting job. Meanwhile, we are left in the wasteland with their legacy, boarded up shops, needless lost lives, and the death of common sense, scientific discourse, and medical freedom that we may never again regain. And why? That's how she leaves it. And why? Oh, that's a whole nother podcast, right? All kinds of theories out there on why. And you guys send them to me all the time. And I don't cover a lot. I don't really cover a lot of the Rona anymore just because I think everybody's kind of fed up with it and we've been through it and we've experienced it. But I wanted to do this one because this is somebody with a background that I think, from a medical standpoint, and I know she's not an anesthesiologist now. She's moved on to something else, but got a background in anesthesiology and a law degree. I mean, she says it pretty straight up. Hey, this is some nonsense. This is some real nonsense. And I don't fall into that real hardcore right wing, whatever that is. But, I definitely don't fall to the left side of the leaning. You know what I mean? And so many of my friends and not necessarily family, but mainly friends, I really feel like they've fallen into that paralyzing fear and it's just unfounded. I don't think I need to be afraid. I never have been. I was thinking back the other day when the beginning of this, like a year ago, now we're in April now. Yeah, March was a year ago. Man, I didn't even think about that when we had the year March 15th, probably because I was in Hawaii. I mean, I could have cared less about the Rona at that point, right? But remember when we used to wash our hands? I washed my hands pretty often to the point where I'm like, I don't really want to wash my hands that much anymore. It just seems kind of silly. And now we are told that the Rona no longer really is a threat to us on surfaces of inanimate objects. Just not a threat. CDC come out and stated that. Not really much of a threat. So, don't worry about that. Well, how about small businesses? How much were they impacted by how much crap we had to do, restaurants had to do, basically rework their entire model for a lot of this stuff. Menus? Oh, you got to go to a digital menu. Okay. So we've been shut down and now we got to spend some more money figuring out this bad boy. I mean, this stuff was just continuous, right? Wash your hands, wear your mask, be a good boy or girl in your case, whatever it might be. So yeah, just a lot of craziness. But I think the paralyzing fear, to me, that's the one big one, because there's a lot of people that are still paralyzed with fear. What are you doing? Oh, I'm hunkered down at home. Rona might catch me if I walk out the front door. It could be anywhere. It could just reach up and bite me. No, probably not. And if it does, you're probably going to live. Odds are you're probably going to live. Yeah, but my uncle's neighbor's gas station attendant, their brother's sister-in-law, they were 26 and they got it and they died. I mean, everybody's got that, why did I say gas station attendant? That really dates me because we don't really have attendants anymore, do we? No, but I like to think that we do in some parts of the country. Man, those gas stations. You have to have one in Oregon because you can't pump your own gas in Oregon. That's just kind of the state of the union in Oregon. They want to control that gas filling experience as well. So, yeah, we've all got those stories you hear of one person somewhere way down the convoluted line that got the Rona that wasn't 78 years old with, pre-existing conditions. But so much of that, the numbers, the data and the science don't support what we did. That's the bottom line. And it still doesn't. And yet we're still kind of putting up with this stuff because we have to, because we're mandated. Here's what you got to do. But I was talking with one of my guys here, Darian, who's our social media manager, and you'll see him on the jet skiing video that we're going to release here very shortly. If I can get off my rear end and figure out a last couple of edits. He was saying, hey, one of the big rave festivals is going to happen in Nevada, Las Vegas. Which one was it? I can't remember. But how are they going to do that? A rave. That's a lot of people together. Some of them maybe even not clear-headed throughout the whole experience. They might have some type of mental alterations going on. How's that going to work? I mean, some states are locked, still locked down. We're going backwards here in Washington, maybe in a couple of counties. And yet we've got a rave festival for next month in May. Interesting times, right? And if you followed the South Beach deal, South Beach officials just lifted the, I think, 8 p.m. curfew they had because so many people went and partied in South Beach, kids, who, if they get the Rona, guess what happens? Well, they might spend a weekend in bed if it's really bad. If not, well, I got the Rona and it's over. And you know what? I didn't die. They know that they're basically immune to it. Oh, what about the gas station attendant's brother's nephew's sister-in-law who died? Well, they just don't worry about that because the percentages are so low. They are not filled with paralyzing fear like a lot of other people. I hope this ends soon. I don't think it will. I think we're stuck with a bunch of this stuff forever. But the guts of it, I'd like it to be over soon. I really would. I'm sure you do too. Because you know why? You're reasonable people. And you look at the data and the science and you go, yeah, this doesn't add up. This paralyzing fear, this doesn't really make much sense. But what are you going to do? You still need to be a good boy or girl, right? And that's what we're doing because we're reasonable people. Toe the line, do what you need to do. But on your own, watch podcasts of people who might think a slightly different way. Okay, that's it for me on this one. Thank you so much. It is Friday. I got to write a script for our Market in a Minute video that I'll record a whole bunch of our other brokers. They'll do that next week. That's what I'm doing. And then I'm going to the gym. All right, kickstart my weekend. That's how you do it. Okay, I hope you guys have a great one. I hope you're doing something fun. And until then, stay safe. We'll talk soon. Bye. That was an awkward bye. All right, we'll see you later. Bye. Don't forget to subscribe to our channel and hit the notification bell so you'll know when our next video is out.